Hello everyone, this is Dr. Nima and this is our last lecture for our science exam, and it is about the supporting structures and the clinical consideration, and technically it's mainly about the periodontium. We've talked about periodontium before in preventive, but this is a little bit more deeper view about it, especially from an anatomical view. We're going to know the different parts and structures that are in the periodontium. And technically the periodontium is the surrounding structures that surrounds the tooth and support it. So it's not the tooth itself, it's the things, well, part of the tooth maybe also, but it's the parts that actually also surrounds the tooth and support it. So we know that, again, we've talked about it. So it is technically we'll see the more accurate divide of these structures. So we have if we looking at this picture, we have the gingiva, the cementum, periodontal ligaments, and the alveolar bone, right? So the gingiva, that it's the part that the gum that surrounds the tooth. The cementum, we know it's the part of the tooth that covers the root, the anatomical root. And the periodontal ligaments, we know it's these small fibrous tissues or fibers that actually extend from the tooth to the bone, and these are one of the main things that gets the tooth attached to the bone. So it's on one side attached in the cementum, on the other side attached to the bone, and you have the alveolar bone that actually holds the tooth in place inside of the jaw. If we want to go further into the division of the parts of the periodontium, definitely the sulcus is part of the gingiva. We'll see this. Units. We have two units in the periodontium. So we have the gingival unit or the gingival unit, and then you have the attached unit. So two things. And as you can see, the gingival unit has three parts. It has the free gingiva, attached gingiva, and alveolar mucosa. And you can see it here. So this is the gingival unit, and you can see it has the free gingiva, the attached gingiva, and here we have the alveolar mucosa, which technically all of the lining of the oral cavity. Other than these, all the gum that lines the oral cavity, so the cheeks, the gum on the cheeks, these things, these are considered as the alveolar part of the alveolar mucosa, which is part of the lining mucosa technically, if we want to make it to say more specifically. The attached unit, on the other hand, are the things that technically attach the tooth to the bone, right? So this includes the cementum, the periodontal ligaments, and the alveolar process, which is technically the alveolar bone here. So if we go back to this picture, you can see that this is the attached unit, and technically this is the gingival unit with all the things that it has. So this is our more anatomical division or structures when we talk about periodontium, and we're going to talk about each one of these units. So the gingival unit, what are the parts of it, and the attachment unit, and what are the parts of it, and what each part of them do, or what are the specific for each part of them. So again, this is a good picture that shows us, again, this is the attached unit that include the cementum, the periodontal ligaments, and the alveolar bone, right, or alveolar process. And then we have the gingival unit, which include the free gingiva and the attached gingiva and the alveolar mucosa. Okay, so we're going to talk first about the gingival unit. A little bit here, and then we're going to go to the slide with the details in it. So you know that the free gingiva is the part of the gum that is not attached technically to the tooth or to the bone, right? Not attached by anything. So here, my mouse just got a little bit problem. So I can move it around. Okay. So we're continuing. We had some technical difficulties. Anyway, this is the free gingiva that is, again, free, that doesn't have any attachment. We see it by the side of the tooth, the enamel especially, and it ends where the gums start to attach to the tooth, and usually it's in the cervical line where it actually connects the cementum and the enamel. That's the usual place for the gingiva to actually, the free gingiva to be the attached gingiva. Okay, so the other one, which is the usual space, that happened between the free gingiva and the tooth, we call it the gingival sulcus or the gingival sulcus, and then we have the attached gingiva from there. So from the start of the attachment almost to the end of, or the beginning of the vestibule almost. That's, we have the attached gingiva, so it's rigid, it's not movable. So this one is free moving, this is not. It's attached to the bone specifically or directly. And then you have the alveolar mucosa, which is a small part of the end for the vestibule, and then the vestibule, that's our alveolar mucosa. So these are the three parts of the gingival unit. And then we know that these are the other parts of the attached unit. So let's take a look here. We know that these are the three parts. Now, if we're talking about what covers them, what is the type of tissue that cover these three parts of the gingival unit, right? We have three parts, and there is a little bit different tissue that covers these than the free gingiva and attached gingiva than the tissue that covers the alveolar mucosa. So the type of the gum, that covers these, like the lining of it, the cells themselves, let's say, for the alveolar mucosa, it's the lining mucosa that actually covers all the tooth, all the mouth, all around the mouth. And then for the free gingiva, it is a masticatory mucosa. We call it masticatory mucosa. That type of mucosa, that type of tissue that covers the free and attached gingiva, this is actually designed to withhold or to withstand the trauma a little more, because again, from the name, it's the masticatory, so it's around the surfaces that we bite on or we eat food around. So these things here, so food can touch here and can cause some trauma if it's not covered by the masticatory mucosa. While the lining mucosa, on the other hand, technically it also part of the alveolar mucosa. It covers it and covers the rest of the mouth. It is thin and movable, so it's like flexible, again, like your cheek, right? It's much more flexible than the attached gingiva that you have around your teeth. By the way, this masticatory mucosa is also found on the hard palate. So the type of the mucosa that covers the hard palate is the masticatory mucosa. Okay. Now we're going to talk a little bit more about the free gingiva. So we know that is the tissue that is from the gingival margin all the way to the base of the sulcus. So this is the gingival margin here. That's the gingival margin, right, where it starts. And then that is the base of the sulcus. So usually that is our free gingiva. That would, that's the space for the free gingiva. The color is usually light pink, but you know that with darker skin, the gingiva, the gingival color generally reflects a little bit darker color. What else? The gingival sulcus, usually that's the space, as we said, between the tooth and the gingiva. And usually the depth of the sulcus, or the normal depth, the healthy depth, when you measure from the gingival margin all the way to the base of the sulcus, it should be about from 0.5 milliliters to 3 milliliters, milliliters. The inner portion of the gingival sulcus, so this side of the gingival sulcus, which is the inner portion, it's covered by non-keratinized type of epithelium. So the cells that covers it. And the keratinized means they're more hard, per se, like they're actually more rigid, and non-keratinized are the less rigid. So the inner surface covers by non-keratinized, the outer surface of the sulcus, is covered by keratinized epithelium, or lined by a keratinized epithelium. And we know that the gingival papilla is the free gingiva that is in the interdental spaces, so it's between the teeth. When the teeth are together, we have that space, and that's where the gingival papilla is at. Talk about the attached gingiva, right? We said we have that other part, as we know of the gingival unit. We have the free gingiva, attached gingiva, and the alveolar mucosa. Now we're talking about the attached gingiva. So we know it extends from the base of the sulcus down. So if this is the base of the sulcus, we know that this is the sulcus, and that's where the attached gingiva extends almost to the vestibule. So like if this is the end, this will be the vestibule, then this will be the cheek around. Usually the attached gingiva, see here, they have the stippled effect, which is technically like an orange peel. It has these small dots per se, like in it, and that is the effect of the retipex. And this is a way histologically, when you look under the microscope, you see that the cells, or the shape of the layer of the cells that covers, it has that wiggly effect, and this is technically how they are connected to each other, and that's what we call the retipeg. And that's what gives us the stippling effect for the attached gingiva. That is the healthy look of the attached gingiva. And since we have this here, we can point out to the interdental papilla or dental papilla, and that's these triangles that we talked about here. The gingival papilla or interdental papilla, these are these spaces here, or the gum that covers these spaces between the teeth. Another picture just to kind of see, again, this is the attached gingiva, and this is the alveolar mucosa. As you can see, that's technically where it starts. That's the vestibule, right? That's the labial vestibule and the maxillary arch. And we know that's the margin of the gingiva, and same thing with the sulcus technically. Moving on, now the other part of the periodontium, we said it is part, it has two parts, just so that we can remember what we talked about earlier here, that we said the periodontium has two units: the gingival unit, which we talked about, the free gingiva, the attached gingiva, and the alveolar mucosa. And then you have the attached unit, which has the cementum, the periodontal ligaments, and the alveolar process. So we're going to talk about the attached unit now. So one of the first parts, it doesn't have a specific order, but we're talking about cementum. So we know it's a hard bone-like, and it covers the root. We know that it covers the anatomical roots of the tooth. Technically, what cementum is made of, we're going to talk about that a little bit more later in different lectures, but it is made of some cells, and when these cells continue and finish their work, part of them would stay in the cementum and the other part would not stay in the cementum. So the part that will still have cells, that is usually on the apical third, for the apical portion of the tooth. So if you're looking at the cementum under the microscope and you look for that apical part of the tooth, you will see that it has cell in it, and that's why we call it cellular cementum. And technically this happened because the way that the root forms, it forms, we know that the tooth forms technically from the top, from the crown, and goes down. So these are the last cells or last portion of the cementum that would form, or the tooth that would form. So it will still have some cells in it, and usually some deposition will continue until the occlusion get in place, and we have that occlusion plane. But anyway, just as maybe an introduction to that subject here, that cementum has technically, if you look at it under the microscope, you will see that it's made of technically two parts. One part is the cellular, which is usually on the apical portion, and one part is the acellular, which means doesn't have, that's one word, acellular, which means it doesn't have cells in it, like the cells are not in here. And that's the most, the rest of the tooth. So that's what the cementum is. And we know that The cementum is the place where the periodontal ligaments would fill into place. Right, it will attach to the periodontal ligaments, would attach to the cementum and to the bone on the other side. So, the periodontal ligaments. So, although we have talked about this a little bit before, but we know that it's dense connective tissue fibers that surrounds the tooth. They connect the teeth to the alveolar bone. We know that they connect to the teeth by the cementum, so they are embedded in the cementum layer, and then they go into the teeth. And these are the periodontal ligaments here in that space. Then we have the alveolar bone. And we know that the alveolar bone technically is the bone that holds the teeth in, so it's the bone that surrounds the teeth. And the tooth socket that actually holds the tooth in it, we call it alveolus. So if we want to take a closer look at the alveolar bone, we'll see that it's actually made of different parts or different layers per se. So you can see on the outside it has a different name. So you have the cortical bone. So again, it's part of the alveolar bone, but it's the outside layer. It's a dense layer that is covering the whole jaw. Like if you're looking at the jaw from the outside, that outside bone or that outside layer is the cortical bone. It's dense and it's thick. And we have another part which is the trabecular bone, and that is also called sometimes spongy or cancellous bone, and that's what's inside. So all of this here inside, that is the cortical bone, right? And we have another type of bone, the bone that is around the roots, that is the bundle bone. So you can see that here, that's the bundle bone, where we have that color here. It's a dense layer, similar to cortical bone in a way, but they call it bundle because it's like it has multiple layers in it. And that is the part of the alveolar bone that actually have the periodontal ligament embedded in. So if we want to be more specific, we'll say that the periodontal ligaments are embedded in the bundle bone on one side and embedded on the cementum on the other side. We also have the interdental bone, and from the name interdental, which means between the teeth. So we'll see a different picture that will show that a little bit better. And we have the interradicular bone, and that is the bone in between multi-rooted teeth. So let's take a look at this here. You can see that this is the technically interdental bone that is between the two teeth. And this is the interradicular bone that will form the interradicular septum that is between multi-rooted teeth. So you can see these teeth, like this is a molar on the mandible that has multi-roots, so it has two roots. So the bone that is between the roots, we call it the interradicular bone. And the bone that is between the teeth, we call it the interdental bone. We have a little bit more notes about the bundle bone. So the bundle bone, as we said, it's formed the inner bone of the socket, when we saw that here. It is the place where the periodontal ligaments attach. And on an x-ray, when you view it on the x-ray, you'll see it really clearly. There's like a radio-opaque part and lining of the surface that we call it a lamina dura on the x-ray. So if you, I have an x-ray here, and you can see that there is a clear line that is here of bone, and that's the lamina dura. So definitely going to talk about that in radiology too, but that is the lining of the socket, of the tooth socket. That's the lamina dura, which is technically the bundle bone, right? Okay. A different picture that shows you a little bit here again, as I said, like the cortical bone is the outside bone that covers the tooth, the jaw. The interdental bone that is between the teeth, and we have the interradicular bone that is in between the multi-rooted teeth. Let's see again, this is the cortical bone, interdental bone here. Okay. Now the last part of the attached unit which is the periodontal ligaments. So again, we know that periodontal ligaments are one of the main parts that holds the tooth in place, but other than that, it actually also gives it a shock absorbing feature. So like if you're biting with the biting forces, to kind of get these biting forces cushioned and to absorb the shock that happened, we have the periodontal ligament. So it plays an important role. The periodontal ligament actually have multiple groups in it. And by the way, Sharpie's fiber, which is technically parts of the periodontal ligaments, are any parts of the periodontal ligaments that are embedded in cementum. So any part of that here, it's considered as Sharpie's fiber. So these Sharpie's fibers have different parts in them, or different groups, and it's based on how they run, the direction that they run. So you have the alveolar crest group, and that is the cervical area around the tooth to the alveolar crest. See, this is the alveolar crest fiber. So this is the crest of the alveolar bone, right, on the top. And from the top of that, we have a group of the periodontal ligament that attach to the tooth. We call them the alveolar crest group. We have the horizontal group, and technically, again, from the name, they run horizontally. So you can see these run almost perfectly horizontal. That's the horizontal group of Sharpie's fibers. And you have the oblique group, and these would run obliquely, as you can see. That's the oblique group. And you have the apical group, and the apical group, technically it's apical and the apical region. So just from the names, I think it's really easy, you know, especially when you see it in a picture. And then you have the interradicular, similar to what we have interradicular bone, we have interradicular periodontal ligaments, and this is between the roots of the multi-rooted teeth. We'll see it here. You can see this is the interradicular fibers, right? And again, same thing here. We have the alveolar crest from the crest of the bone, and you have the horizontal, you have the oblique, and you have the apical fibers. We have other ones. You have the gingival part, or gingival group, that has transeptal fibers that runs between the teeth, and we have like gingival fibers that we saw some of them here. Let me see, is it in this picture or this other picture? I think, yeah, see, like these are the gingival fibers. So these are fibers that attach to the gingiva. But anyway, we're talking here about the Sharpie's fibers, and these are the ones that embedded in cementum, and we know that these are the group that are embedded in the cementum. From what we've talked about, the attachment unit has a lot of functions. So supportive, it supports the tooth, prevent the movement. Nutritive, because of the blood supply in the bone and in the gums, right? Formative, it helps with the cementoblast, and these are the cells, right, that form the cementum, and help sometimes also build up a little bit parts here and there. And sensory, because of the nerves. So these are different things or different functions of these units. Let's just go back just to make sure that we are aware of all of these divisions, just to kind of get the bigger picture. So again, as we said, we're talking about the periodontium. We know that the periodontium has two parts in it. It has two units, if we want to say. You have the gingival unit. Technically, that what involves the gingiva, part of it the free, and part of it the attached, and part of it the alveolar mucosa. And then you have the attached unit, and these are what attach the tooth to the inside of the jaw. And technically, this is the cementum, periodontal ligaments, and alveolar process. We're talking about the lining of these things. What is the type of the tissue that lines these, and what are the type of tissues that lining these? So these two are lined by the masticatory mucosa, the lining of them, right? And the lining of the alveolar mucosa is the lining mucosa. So all of that is in there. Now the last part here, there are different forces that move the tooth around, especially because we're talking about the periodontium, which again that surrounds the tooth. So there are normal or regular forces that we have generally, within the oral cavity. So we have the mesial drift, that teeth are always trying to move forward into the arch, and we have the active, but usually is held by each other. So each one of them hold each other, and that's why, when we have a third molar, sometimes we want to extract it, because otherwise it will push all the teeth, and then we will have crowding because of the mesial drift. Another force is the active eruption. Technically, all the teeth are trying to keep erupting up, but because we have the other force, which is the masticatory force, that will equalize the pressure. And that's why if you have a tooth that is extracted on one arch, the other tooth from the other arch will, erupt a little bit more up to get that space, because we have active eruption forces. As far as I know, I think the rats, their teeth continue to, well, not erupt. I think they can continue to form more than erupt. And if they don't bite things to kind of get their teeth wear off, they can be too long that they can actually go through their skull or something like that. I remember I heard that somewhere. But anyway, we have also external forces that we might apply to the teeth, and that is the orthodontics, definitely orthodontic forces, and sometimes traumatic forces. If we're looking at this picture, you can see when you apply force, the periodontal ligaments would be tight or tension. You have tension on one side, and you have pressure on the other side. And let's look here again. You have pressure here, and what happens when you have pressure, you usually have resorption, and what happens when you have tension, you have build. So this is technically how the teeth move. When we apply the pressure on them in a specific direction, whatever direction that has the pressure on it, it will activate the cells to destroy that part of the bone on one side that has the pressure, and on the other side it will has the tension, and it will activate the cells that will build the bone to build it up. And that's technically how we have a build and resorb on one side and on the other side. These are the forces that happen, and that affects our periodontal space. That's it for this chapter. It is short, but it's actually have a lot of information. Make sure that you know the names for each of these that we have here in these pictures, and be able to recognize them. We have a few things that we mentioned here and there, and that is our periodontium.